The theme of the month is neurodivergent health. As I think we should share with our audience that not all our patients are neurodivergent, and certainly not all our patients I would identify as being neurodivergent, and they come because their needs were not met by the traditional healthcare system. That's what they have in common. That's what they all have in common. And amongst that group, the overwhelming majority of our patients have this pattern, right, of neuroimmune conditions.
I think they most often talk about not feeling listened to or heard. And I know that's kind of a vague thing, but I think feeling like they're having their symptoms dismissed, whether that's because, oh, you're young and no, you can't be in that much pain, you can't have this thing, or oh, this disorder is so rare you couldn't have it.
I was talking to another provider about, neurodivergent healthcare and how some medical conditions tend to coexist, and that there's like actual literature and papers out there about it. And this is someone who's probably like 5 to 10 years my senior. Like, they've been in practice that much longer than me, and they had no idea. They're like, I didn't know that, these things happen together. And so I think the issue is that these things are not on people's radar, that because it's not being taught in school.
Right. So let's start there. So what do you remember, if anything, about what you were taught about autism and ADHD?
Nothing. I had no idea they could coexist.
Yeah. I was never taught that they could coexist.
Yeah.
Despite they almost like they coexist more often than they don't.
Right.
Yeah. I feel like for me, autism education was like developmental milestones and MChat and that type of stuff for kids. And then ADHD was, this happens in kids and we use stimulants to treat it. And then
they were separate.
I mean, I was not taught that autistic physiology was different than non-autistic people's physiology. Like, I was taught, there was like, the deficit-based paradigm of like, here are the things that are wrong, and we call this autism. In kids, there was never a discussion about autistic adults. I don't know, like, I don't think that I had any ideas about autistic adults, despite being one and not knowing. But like it was just never on the radar that like there were autistic adults, let alone the medical conditions that people have. So like when the list of all the co-occurring conditions, these were all things that kids had. There was also like, the medical conditions that all the autistic kids had. It was very strongly implied, if not explicitly taught to me, that it was like patient blaming, like you have gastrointestinal things because you only eat chicken nuggets and pasta and you don't exercise. So that's why you're constipated. Like, not that you have stretchy colons that get all stretched out.
Right. Increased periodontal disease because of not doing oral hygiene.
Right.
I mean, and this is more systemic, right, in the healthcare system, but the zoomed in style of teaching, like, there's psychiatry and there's gastroenterology, and there are all these things that are separated, but in reality, there are so many things that are interconnected that it's silly that we're not taught more of a like zoomed out picture. This is like an entire being that has multiple systems that actually work together and rely on each other and are influenced by like how your DNA is being transcribed. And it's unfortunate that more of that zoomed out approach to teaching medicine isn't taught, because it results in the zoomed in, like looking at these two things that you already know coexist and not seeing the bigger connections with some of these other things, and how how that impacts people in the healthcare system, impacts patients in particular.
Yes. And I think that what you said is really interesting, because I think that I would describe my medical education as being very top down. An autistic patient is more likely to have X, Y, and Z list of conditions. Top down, you memorize the associations and they're tested on board exams. But that's not how the patient comes in. The patient comes in bottom up. And in a healthcare system that is so fragmented, like you said, the opportunity, the pattern is not created in a zoomed out enough approach. The pattern is created with way too, and even people with the type of brains that are really good at pattern matching, the whole picture of the pattern was not taught because it's not known. And one of the reasons it's not is that these patients are thought to be rare, right? So if what's described is that 2% of adults are autistic, I mean, there's zero chance that that's true. It would need to be more than that. But anyway, it's thought to be rare. So why would medical education be structured on this entity that is rare? Because what's missed is that the neuroimmune conditions that are more common in autistic and ADHD people are connected to the things that are known to be very common. So, when we think about, like in our practice, right, how we see a lot of mast cell dysfunction, and guess what? That's connected to diabetes and hypertension and like all the things, right? So
right, and IBS and mood, anxiety,
migraine. I mean,
migraines.
It's connected to everything, but yet,
yeah,
not zoomed out enough to.
I think that's what primes primary care providers for doing this type of work, is because theoretically they're the ones who are already doing that kind of like look at the full body and the full patient, and they're the ones who are seeing all the different things that are going on and know the patient longitudinally enough to theoretically be able to kind of see the connection between everything.
But what I would say is that even though we have a population of clinicians who are ideally poised to spot the pattern, we have a medical system, a healthcare system that is thwarting primary care clinicians to have full access to their cortex, right? Like, so we have this healthcare system that is forcing primary care clinicians to see, a patient every 10 minutes, 10, 15 minutes. And
most practices are 15-minute visits for follow-ups, 30-minute visits for new patients, or, wellness exams or whatever. And on top of that, you're managing an electronic medical record system and paperwork and interpersonal work stuff. It's like you have 5 or 10 jobs within one job already. And so I don't want to, the blame is the system. I don't think that people go into medicine intentionally wanting to dismiss people at all, but it's something that ends up happening. You're exhausted, you're tired, you didn't eat breakfast, you didn't have time to eat lunch, and then you lose what's it called? You get dysregulated. There's a line that happens, and you're like backed up against a wall and feel like in some ways it may be the provider kind of advocating for their own access needs by saying, okay, we don't have time to talk about this today. but not knowing that's how that makes someone feel.
You don't have the cognitive resources to do what needs doing in that moment because the system is thwarting you. And so you don't have the ability in that moment to zoom out, because that's an executive function. It's like a higher order brain skill to zoom out, to self-monitor, to know like what you're saying, how you're saying, your tone, your body language, all of this stuff. And I think that there's a lot of, really inadvertent communication breakdowns that
unintentional dismissiveness.
Yeah. I think like what I hear a lot, like when we have new patients, the overwhelming majority of our patients have this pattern, right, of neuroimmune conditions, that there is physiology that explains these multi-organ system symptoms. People show up and they have like this laundry list of diagnoses, and like, why would it make sense that a human being would have like 40 things wrong with them? Turns out, their connective tissue is different. It's just a different way of being wired. And it just so happens that these physical health conditions, which, are exacerbated by dysregulation. And when your access needs are thwarted by like, all of the systems, this actually drives like a worsening of neuroimmune conditions. But people don't know that. Nobody knows that. They just like feel broken and they're told that they are broken, and then they're like shamed for seeking help. So like, anyway, shamed for seeking help, shamed for seeking help in the way that you authentically communicate when you seek help, and shamed for not complying with recommendations that don't work for your brain.
Right.
When we hear their story, they can trace this back for like decades, right? Like decades.
Yeah.
And it's about having the opportunity to share your story in the way that works for you. So some people need to info dump their story with mouth words. Some people need to
bring a list.
Yeah, right. They're the patient with the list, right? The one that's like shamed and othered by the healthcare system. They wrote that list, and that list is incredibly important because it has all the information in it. Like, anyway, there's some people like, we have a patient who I'll never forget, new patient visit, brought a mind map that showed me like, all the things that like, this makes it worse, this makes it better. And I'm like, I know that pattern, right? So like, if you get the patient's information in like their, so say like in their native tongue, like in the way that they best communicate, you get a ton more information, but the system thwarts patients from communicating.
The people come in. I think the other thing that I often see, especially with kids coming in with neurodivergent kids, especially, is just that they have not been able to access care in other settings, just due to the like sensory overload of the specific setting. And so whether it's like providers not knowing their sensory needs beforehand, before actually coming into the visit, or like just before walking into the room. Whether it's like the fluorescent lights, whether it's thinking that they're going to need a vaccine the entire visit and being anxious and not interacting the entire visit until they know they don't need one at the end. And that's why I like having the like information before a visit of what somebody needs, what their sensory needs are, because starting off the visit that way makes such a huge difference. And if we didn't have that, I wouldn't know necessarily.
Well, you left something out. How do we have that information? We asked, right? Like that's the thing, right? So if you ask people what makes them comfortable, and you ask and like you try to do those things, they usually have a better healthcare experience.
Right. Yeah. I mean, it's just the systems within the systems already have like their standard expectation. Like, this is how you communicate, this is how you take information. Like, people teach you how to take notes. Like, when you're in school, here's how you study something, without ever knowing how your brain works. Like, and then you try to fit yourself and mold your brain and your whole way of being into the box that who knows who designed it, but the box that has become like the standard expectation of how to communicate, how to interact, how to socialize, how to just exist, how to be within the workplace. And it's suffocating.
Yeah. I mean, I remember even like as a pre-med student, like, my volunteer gigs or like some of my jobs after college before medical school, like it was just so clear that there was judgment going on, and that what you just said, like, that there's one right way to do the thing. There's one, like it was just so clear that it was not okay to show up as one's true self, not just as a professional, like as a patient. Like, I remember being like a young 20 something, and I remember being like, I hope, like, I have to do something. I have to do something to make sure they don't think I'm weird, or that I'm like melodramatic, or that, anyway, I have all the things. I have all the things. I've always had all the things. And as a patient, I've never, I've never had care for my all the things, because I never tell anyone my all the things, because that's a surefire where to get judged.
Yes. Not because it's funny, it's just it's one of those, it's just act in this way, communicate in this way, or you will go unheard.
Yes.
Like, you have to communicate a certain way, or you won't be heard. And not everybody can make that adjustment. And so those are the people that are staying away from healthcare because it's overwhelming or confusing or uncomfortable or unsafe to.
Yeah.
I feel like I say that so commonly. Like, if I'm talking to somebody about like being in a pre-diabetic range, and before I even say anything, they start with, but I eat well and I've been struggling with my weight in my entire life, and like preface it with like, I'm doing all the things. Please don't blame it on me being at fault, or blame it on my weight. And it's just so ingrained in patients to kind of preface a visit with, these are all the things that I'm doing, because otherwise it's so common for it to, because that's how we learn. We learn that diabetes is lifestyle factor related, and that's the only thing, versus inflammation and genetics and all the other things
And
that
mast cells.
contribute to it. Right. And that like weight isn't always totally changeable.
Well, it's also that, like, I mean, this is like such a bigger picture. Like, so not only is there a right way to be a person, but like the message that there's a right way to be healthy too. And like, so, when you think about like all of the anti-fat bias and shaming that goes on in the healthcare system, I mean, it starts in childhood. I mean, it's so bad.
Yeah, I think shame is unfortunately one of those things that is, I don't even know why either, taught from the very beginning, as children.
I wish that it were normalized to say when you don't know. Instead, what is modeled, or what was modeled for me as a trainee, is that you fake it till you make it, and that when someone says a thing that doesn't match your worldview, you quackify them. Well, that's not a thing.
I remember hearing in medical school, and thankfully I had a nutritional biochemistry background, so they said that taking vitamins is just paying for really expensive pee. And I was like, they were like, well, why would they say that? Because they stopped taking the vitamins because they felt guilty and shame. And I was like, because they don't know biochemistry. they don't understand that nutritional needs of different humans are just as different as the brains that are operating. So instead of saying, I don't really understand how the human cell and mitochondria and all of these different vitamins and minerals interact, so I'm going to say that taking vitamins is stupid. You can get enough from what you eat. And then I'm going to teach that to people that are training under me, who are then going to say these things to patients, and we all just don't know what we're talking about.
Yep. I remember being taught that people, quote, outgrow ADHD. Kids outgrow ADHD. And, you know, I believed that. I was taught it, despite being, you know, an undiagnosed ADHDer. Like, anyway, that kind of mythology is just so widely held. It's the same way, like, I remember as a trainee, you know, the patient with the list. And like, I thought that was awesome because I'm a visual processor and I wanted to read the list. And but anyway, that person gets shamed. But also, like, the patient that comes in and says, you know, I read about this on, you know, WebMD or some other website, and like, I read this article, and I want you to, like, you know, how does this fit into my like, I don't know, I just always thought that was awesome because they were engaged in their health. And anyway, it doesn't, it's not that hard to be like, I don't know about this. Thanks for the article. I'll read it and we can talk about it again next time. It's not that hard, but that's not modeled. The opposite of that is modeled. But like, in the context of what we talked about before, where the system is like, you know, you must see the patient every 10 to 15 minutes. Like, so now I have something else to do.
Right.
So
it's unfortunately, I think within the medical community, it's learned behavior, and learned behavior from maybe, you know, someone else's teachings that the list is bad and those patients are complicated, and you know, the eye rolling and all that kind of stuff. It's learned. We weren't taught how to really manage that, you know, as a, you know, well, just see them more often.
right.
Wow. Okay.
Right.
It's that easy.
It is that easy.
And I think, like, coming back to the, like, not feeling comfortable saying you don't know things, like, there's this expectation that a healthcare provider knows everything about every single body system, and that's not feasible for anybody, I think. I mean, I certainly don't know everything about every body system.
Like, primary care is really hard. And
Yeah.
primary care is really hard. There's so much to know. There's so much to spot. You're on the front lines, and then you have the system thwarting your ability to do what you're trying to do for your patients. You don't have full access to your cortex, and you're trying to survive. And like, it feels a lot like treading, you know, it's like treading water, and like trying to survive and trying to do everything you can for your patients. There's just, it's so much.
Yeah. And I think for those in traditional primary care practices, whether you're hospital owned or private, I mean, what's normalized is the dysfunction of the system. It's like, yep, this is just the way it is. So, you know, so that's what we have to do. So we're just going to keep doing it. And just felt like there has to be a better way to do this, but like everyone's stuck.
It's a failure of imagination, right? So like, what we do all day, I mean, the only reason we're really able to do it is because we don't have a bureaucracy. Like, the patients need a thing, and we kind of like try to figure out how to do that thing. And like a systems get dysfunctional. I mean, like, I think individual providers are most frequently operating in systems where they don't have autonomy or agency to do all things. Like, when I do trainings for, like, in services for healthcare practices, or even like at, you know, conferences, like, people are like, oh yeah, that's really great that you can do that thing in your special setting. But like, you know, us people in the trenches, you know, what about us? And it'd be good to wrap up maybe talking about, like, what are some things, not just like, you know, what are the medical conditions we manage and how do we manage them, but like, what are some things we do that are free to do that, like, I don't know, are different than in other settings, because I think that one of the things that we do is, I think we teach patients that they are the experts in their own bodies. Many of them don't know that. This is like new information that they're getting. That lens is really a requirement for trusting your intuition, for connecting all the dots, for learning about your access needs and naming it when they're not met. If you don't think that you're the expert in your own self, because you got messages to the contrary your whole life, it's huge.
Yeah. Yeah, that's definitely makes a big difference. I think as a practice, us, you know, before patients even come in, we're asking them, before they even become our patient, they know that we care about how they learn information, how they would like visits to go.
Giving people choices of sensory needs and ways to access care, and a lot of those are free, like turning off the fluorescent lights in an office, or letting people bring fidgets and whatever they want with them, and making that explicit, that like you can bring whatever you want with you, having things in the office for people to be able to write their own notes so they don't have to bring their own things.
I think we often get feedback, right, that patients have never been asked for what they need.
But the fact that we asked means that we care, and that makes
Right.
that patient that much more comfortable to share things in their like authentic, unique way.
Right. And the fact that, like you said before, Gabe, about how, we were trained to ask questions a certain way. Like, guess what? There are some brains who can't answer questions in the way that they're being asked in that default way. And so, like, just the idea of, open-ended questions do not work for all brains. And the idea of providing people with a menu for examples of, like, these are things we offer all people with all types of brains, and you can let us know if any of these things would be helpful to you. And it's not because you have, an issue, you don't have a sensory issue or a communication issue. It's that you would just find these things helpful to have available to you. That's all. The other thing that I think that I've learned in this past year and a half is that, like, about just the idea of healthcare as community. And
Yeah.
I think that has really stayed with me, because I think that's what one of the key things that we're doing. I mean, like, it's not for everybody. That's why we try to be really transparent about the model here, and have people not join, not come when they're not looking for this model. But I remember at my old practice in a traditional setting, I remember meeting with people back to back who had no friends, totally socially isolated, and it was like they actually like loved the same things. And like the healthcare system says that HIPAA, you can't do anyway. But like, turns out like they can introduce themselves to one another if you build a forum that they would both come to. Like, think about how much we have learned from patients, like coming as this village. Like, when we think about like all these really complicated medical conditions that most of the healthcare system doesn't understand, when you bring patients together and you give people an opportunity to describe in their own ways what their experience is like and what helps and does not help, people feel alone. They feel just alone in their lives. And once they know that they're not, there's so much healing in that.